about the three waves of safety and practice in general surgery. Can you explain this concept? I found it super interesting because there are different levels of innovation that you had mentioned that have allowed general surgery to become what it is today and in the future to become what it will be.
I just by chance came across a paper written in the Harvard Business Review by a surgeon called Amir Ghaffari, who at the time was a professor of surgery at the University of Michigan. And by the way, it's so interesting. I cold emailed Dr. Ghaffari and asked him if he would like to come to Vancouver as a visiting professor. And he responded and he said yes. And he came in November and headlined a symposium that we ran called Surgical Systems Redesign. And he turned out to be an amazing person and become a good friend. So what Dr. Ghaffari said is that the history of innovation in surgery has three waves of innovation in surgery. And so what he does is he draws a graph, and on the x-axis of the graph is time. On the y-axis is patient mortality. And it's a conceptual graph. And what he shows is that he shows three curves, declining curves that hit a inflection point, decline again, and then the third curve that hits an inflection point, declines again. And basically what he says is with each innovation, we drop mortality in surgery, but eventually the curve starts to level off. And then you have the next innovation and it drops mortality again, but eventually you have some diminishing returns and the curve levels off. And then the third innovation drops mortality again when the curve levels off. But it's fun to hear what the curves are, what the curves represent. So the first curve is technology. The introduction of technology in surgery drops mortality. Things like laparoscopic surgery, or in trauma, we have damage control surgery. These things have an impact on mortality, but eventually that impact starts to level off as technology is adopted. The next curve is standardization. As we standardize healthcare, meaning that we do it the same way every time, we reduce variability at each step, mortality drops again. And that means that the knowledge that we have of surgery begins to permeate, all hospitals and all surgical services. And so that standardization kind of levels the playing field between services. It creates a uniform excellence. But eventually the benefits of standardization also level off because all patients are not the same. And, so there's kind of a limit to how standardization can, eventually you'll have to tailor care to individual patients. And the third wave of innovation is the wave that we're currently we're at the cusp of. And that wave is creating systems that are complex, adaptive, that learn, that emphasize the culture of care, that emphasize individualization of patient care. That you could call that wave the wave of learning health systems. These are systems that begin to analyze data, collect data, analyze it in detail, visualize data, and report it, and learn from every patient that comes through the system. So that's sort of the interesting point where we find ourselves now, is where we know how to integrate technology, we know how to standardize, but can we function now as complex adaptive systems that can bring the right therapies to patients, at the right time? Healthcare, surgical care has become more complex with time, and we can achieve a lot more. But I think the key is, can we integrate multidisciplinary inputs for patients to match the complexity that they present to achieve great outcomes?